Hey Rick, I'm working from home. I'm Mike. I'm the neuropathy nurse. So I thought it'd be easier if I kind of made a quick video and explain instead of typing and typing and typing. So there's over 100 causes of peripheral neuropathy, and diabetes is the most well known, right? But what most of those causes have in common is why you feel symptoms, right? So in your case with the diabetes, we know it affects the circulation. We know we got to worry about wounds. We know we got to check our feet and do all that great stuff because if we get wounds, they tend not to heal very well because of the lack of circulation, because they're not getting enough oxygen and nutrients, and they can't even remove the toxins as well, right? But also, let's talk about the neuropathy is that those little blood vessels around your nerve cells and the surrounding tissue that makes you more susceptible to wounds and things, they're shrinking up, right? That's what's happening, and your cells, they're not breathing, right? And this is why you have symptoms. And now when you're on your feet, you're moving around more. It's like if you go exercise, it requires a little more oxygen and it's already deprived, they're going to hurt more. But what's the option, right? To sit in the chair and not work, to sit in the chair and not spend time with your family and your loved ones and your friends and do the things that make you feel alive, right? So then you go to the traditional doctor and they want to give you gabapentin, they want to give you antidepressants and all these other things to control the symptoms. But if we control the pain, it's doing nothing for the lack of blood vessels, right? But anyway, just to kind of put it in perspective, okay, so this is what's happening. The blood vessels are shrinking up, right? And diabetics, right, when they have wounds, if they're not healing, they get IV antibiotics, PICC lines, debridements, and the last line of defense is hyperbaric chambers. I imagine you've heard of hyperbaric chambers, and in wound control, in a diabetic, if that they've exhausted everything, right now we're going to go in hyperbaric chambers, and that is going to they're going to take the dressing off, and they're going to be a pressurized room with high oxygen concentration. They're trying to drive the oxygen into the wound from the outside, right? Because that's what it's lacking to heal. And it can work, and it takes, can take a long time, up to maybe 40 treatments, but the wounds heal somewhat faster because they're getting the oxygen they need. So in this neuropathy treatment, right, part of the approach is they use some technology that was discovered by NASA over 50 years ago for wound healing in space. Stay with me. Right? NASA discovered this stuff a long time ago that activates blood vessel growth internally, just the body's process without any injections or things, to just activate the body's ability to make it so, and then wounds would heal faster. It wasn't until relatively recently that the use of this technology was discovered to be helpful with peripheral neuropathy, because going back to what I was saying, there's over 100 causes of peripheral neuropathy, and what they all have in common is why you feel symptoms, and that's because those things cause the blood vessels to shrink and shrivel up. Medicating for pain, medicating for anxiety, depression, sleep does nothing about getting this back. So the technology that my doctors use, they use part of this NASA technology and some other stuff that's fantastic. And they get that blood flow back. So you were asking, what is your next step, right? Because your primary doctor is of no help and has no guidance and is just saying, it is what it is, learn to live with it. Your next step is to schedule an appointment with a doctor, and who I call a root cause healer, and get this checked out. They'll do a nerve scan on you, right? They'll do a 16-point sensory examination and pinpoint the level of deterioration that you have. And if they feel like you're a good candidate for what they have to offer, they're going to offer you a position in their program. And here's something you need to know, because if you're offered a position, they have a very high success rate, but if you're offered a position, what that means is they expect you to get great results. And knowing that there's a lot of confusion and even some skepticism around the treatment of peripheral neuropathy, right? Let me kind of break down what great results are. And, there's root cause healers across this country. There's 1,000 or more of them. And they treat using the similar protocols. And out of the hundreds of thousands of people who have reversed their symptoms, got the blood flow back to their nerve cells so the symptoms go away, of the hundreds of thousands of people, the vast majority of them started having noticeable and lasting improvements in as quick as 3 weeks. I've treated patients, it's been 17 days, they start feeling stuff, right? It's awesome. Right? And the remainder of patients that follow their treatment plan, they start feeling it inside about 5 weeks. Right? Basically, there's only two reasons you wouldn't get help. Number one, there's a big mistake and you don't have peripheral neuropathy. All right, well, you have diabetes, you've had tingling for a while, now you're up taxing the nerves and they're suffocating, and now you're having bigger symptoms. It's only going to get worse. This is a progressive condition that, if not treated properly, will become debilitating. So I am super happy that you found us. All right. So, this is what I wanted to share with you. And, let's get you in for this consultation. Let's turn this around. So glad you found us. Awesome. Take care.